All right, so we're going to go ahead and get started since it is 1 o'clock. Thank you all for joining us today at this roundtable discussion. We have two presenters with us today, Myles Castro, who is the program manager at Sinai Urban Health Institute, and then Adlaide Holloway, who is community health educator at Sinai Urban Health Institute. I'll go ahead and turn it over to you both to begin.
Great, thank you, Priya, for that introduction. So again, my name is Myles Castro, and I'm going to be presenting with my colleague and co-facilitator for this program, Adlaide Holloway. So we're going to be presenting Research Activism for Youth, facilitating a socially distanced, flipped classroom, virtual health equity, and community-based research activism program. So here's our agenda for today. First, we'll start with the background and the purpose of the RAY program to talk about its goals and overall purpose. Then Adlaide is going to come in to talk about year 2 of the program. Talk about by the numbers, so who was involved, how many sessions we had, etc. Then we're going to talk about updates we had to make to the program due to COVID. And I know a lot of us who are facilitating programs this summer had to do this. So later on in the discussion, we want to hear your stories and how you had to adapt to COVID. Then she's going to finish the session, that part off with talking about the curriculum and the activities we accomplished throughout the program. Next, I'll jump back in and talk about program outcomes, talk about strengths and areas of improvement, and how being online really affected these areas. And lastly, as I mentioned, we want to have a discussion session to answer any questions you might have, and to also hear about your programs and hear how they were going and how you had to adjust to COVID, particularly if you had to go online when your initial program was in person. So before we dive into Ray, let's do some quick introductions. Adlaide Holloway, I'll start off with you.
Hey, good afternoon, everyone. So as he said, my name is Adlaide Holloway, and I am a community health worker with the Sinai Urban Health Institute. It will be 5 years in December. In general, I educate on asthma and diabetes management and prevention, or management. And I also implement a diabetes prevention program, and this is my first year participating as a facilitator for the RATE program.
Great, thank you, Adlaide. Again, my name is Myles Castro. I'm a program manager at the Sinai Urban Health Institute under their Health Equity and Assessment Research Strategy. As Adlaide mentioned, we're both part of SUHE. And SUHE is the research arm of Sinai Health System located on Chicago's west side. And we're a team of about 30 public health professionals, such as epidemiologists, community health workers, program managers, research specialists, etc. And SUHE's 3 main strategies are: 1, that health equity and assessment research strategy; 2, community partnerships and interventions; and 3, program evaluation. So let's jump into Research Activism for Youth, or the RAY program. So I think it's really important to first start with what is research activism. It's such a critical component of the program. So the definition we used was leveraging community-based research to stimulate community action and policymaking that addresses the root causes of health. And this may sound familiar to you because it sounds like very much so data-driven research. But what I want to emphasize here is the community-based research component. And to really expound on that, I want to use the focus statement of the Health Equity and Assessment Research Strategies focus statement at SUHE. So their focus statement is to co-create knowledge by, for, and with communities that can be used to mobilize stakeholders and community members and organizations towards health equity. So let's return to that community-based research component. So not only do we want to get community members involved, just not in completing surveys or being part of focus groups, but we really want them to be part of every step of the research process, right? To be able to, as this quote says, co-create knowledge by, for, and with communities. And with that said, SUHE has an amazing community advisory committee made up of community organizational leaders and community members from Mount Sinai Hospital's service area, which is predominantly in Chicago's west and southwest sides. And they were such an integral part in developing Ray in terms of determining where to recruit from, what activities we should pursue, how and what we should teach to youth. And these were such critical components, and they were a huge part of Ray's development. So let's talk about the goals and the learning objectives of this program. So the overall goal is to expose youth from Sinai service area. Again, it's Chicago's west and southwest sides, to health research and advocacy in order to empower the youth to make change, to take action and create positive change in their lives and communities. So with that said, for the learning objectives, participants will first learn about community health. And this is really important as a baseline to start learning about public health research and advocacy, right? For youth to understand what are the assets and challenges, not only in their communities, but also in neighboring communities, and how their communities compares to others. Next is participants will gain new skills in public health research and advocacy. And when I say gain new skills, it's really, I want to emphasize this, an introduction and exposure to public health research methods such as quantitative data and building community relationships and conducting one-on-ones. And of course, advocacy. And we did this through a community leaders panel where they talked about conducting community-wide interviews to learning and working with the communities to promote change. Next was participants will grow in their confidence and empowerment. And this was such an integral part of Ray. And I'm going to talk about this further in just a minute. So I'll move on to the next objective, which is participants will become more aware in public health and advocacy as career possibilities. Many youth, including myself growing up, when we talked about public health and advocacy, the first careers that came to my mind were like doctors, nurses, politicians, lawyers. When now we know as public health professionals, it's more intricate than that, right? You have epidemiologists, you have community organizers. And so we wanted to make the youth more aware of these other professions through a young health professionals panel, where they were able to talk to these young health professionals about their careers and to really talk about barriers that these young health professionals had to overcome and how they did it to help the youth overcome barriers of their own. So again, as I mentioned, youth empowerment was such an integral part of this program. The three main messages we wanted to get across was that the youth are the community's greatest asset, that the voice matters, and that they have the power to make positive change in their communities. As we know, youth are often undervalued in our communities, right? We often take youth for granted. We don't really listen to them as often as we should. But in reality, youth oftentimes have sometimes more knowledge than us as adults of what's occurring in their communities, right? Youth are outside playing, they're biking around with their friends, they're biking throughout the community, right? Versus adults who are often just going to and from work or just staying at home, working from home, right? And another thing we wanted to emphasize to the youth is that change takes time, right? And for youth, which are the community's greatest assets, to make change happen is that now is a better time than ever to start making change and to start making change with the youth now. So Ray, year 2, I'm going to turn it over to Adlaide to really talk about the second year of the Ray program.
Yes, thank you, Myles. So year 2. So first, let's look at year 2 by the numbers. So we had a total of 6 participants, and we had 2 peer mentors this year. Our participants and our mentors range from the age of 16 to 19, so high school or just graduated from high school age students. And their ethnic or racial background included 25% Black or African American, 50% Latinx, 12% were of Asian orientation, and 12% identified as biracial. And our program ran for a total of 6 weeks, And in those 6 weeks, we had 16 sessions, 6 participant mentor check-ins where participants checked in with their mentors, and 12 mentor facilitator check-ins where the mentors checked in with the facilitator, which was me this year. As group activities, which included the in-class sessions and additional sessions that we implemented later on as the program developed, and class discussions, which were available on a virtual platform that we utilized called Basecamp. And so this year, we had a community health worker, which was myself, and a research specialist. And so this year we brought in the community health worker because we understand that they're a person from the same or similar community as the students. And we hope that by bringing in a person who has that experience, that it would help with forming connections with the concepts covered in the program. So now, year 2 updates include the lessons we learned from the previous year. So we received feedback that those who participated would like to come back next year. And so that's where we implemented them as peer mentors so they can bring their experience and to encourage and promote and provide an opportunity for them to have a role in leadership. And pardon me. And so in addition, we also updated the facilitators. And so I would say overall, to enhance Ray's focus on building youth leadership, 2 Ray participants from the summer before, our 2 peer mentors, served as peer mentors in 2020. Those peer mentors worked with SUI staff, which was myself and Myles, and sometimes a behind the scenes additional senior epidemiologist to help guide the participants in different projects such as photo voice and presentations to answer questions related to the curricular content. And so some of our updates were also out of the motivation or in response to COVID-19. And so that specifically includes us shifting to a virtual platform. So we leverage using, again, an online platform that facilitates remote working to administer this program, which was Basecamp. And so we were able to transition into providing this the Ray program virtually with the assistance of that Basecamp platform. And in addition, based on the 2019 feedback, to maintain engagement in the new virtual format, we created what we called a blended learning format. So that included shortening some of the sessions and then redirecting them into field activities. So activities they did outside of time that we normally spent together. So we changed our 4-hour sessions to 2-hour one-on-one, 2-hour sessions, and then included one-on-one in-person sessions with either a peer mentor or a SUI facilitator. And so another update was our recruitment. So our initial main source of recruitment from last year was canceled due to COVID, and that was One Summer Chicago, which is associated or a program provided through the Chicago public school system. And so we had to rely more heavily on our community networks to identify and recruit participants. And so next year we intend to re-engage our relationship with One Summer Chicago and to also rely on our community networks. So here is an overview of our weekly structure. It reflects our in-class and our new field activities. And so in-class sessions, we all were together and present, and that happened every Friday. And then they had from Saturday to Wednesday to then complete the in-field activities, which were available on the Basecamp and were expected to be completed by Thursday. And in between that, they also had the opportunity to connect with their mentors, and we tried to provide to allow them anonymity connections with their mentors, but we suggested that maybe they meet on Tuesdays. And so here we have our curricular overview. Again, we had to make some revisions in response to transitioning to a virtual platform. So this summer, to strengthen our focus on civil engagement and enhance instruction related to activism and community organizing, we reviewed our curriculum with our CAC that Myles showed you guys a beautiful picture of earlier, so that we can make sure that our approach was responsive to community needs and ongoing efforts to our communities that we serve. And so we shifted some of our, pardon me. So we shifted our glows and grows session. So our sessions include 6 sessions, and we shifted our photo voice, which we usually do in week 3, up a week, for 2 reasons. One, to shift to the new presentation of the virtual platform, and 2, because we wanted to, this project, this particular activity emphasizes the importance of using visual media for interpreting and presenting data in a more dynamic, quantitative way. So photo voice specifically is using photos to discover your community in a qualitative and quantitative data format. So it's a photo and a caption to further explain what is happening, to express what is happening, being captured. And in that photo voice week, we had a epidemiologist who came and guest spoke and spoke in detail on the importance and the relevance of using photo voice in research activism. And so also in week, I'm sorry guys, looking at the tiny picture. Also in week, pardon me you all, I'm so sorry. Right, okay. So we also shifted up some of our other programming and amended them to make them more dynamic and relevant for online platforms. So again, along with photo voice, we adjusted the introduction to understanding and visualizing public health, again, to re-emphasize the importance of visual representation of data. And so in addition to that, and you can hit it again for me, Myles. We shifted our tours of community assets, which we usually do in week 2. We changed that to an activity to week 4, where we brought in a panel of young community organizers and activists to speak on real-time implementation of the different concepts that we presented in the sections. And so here's a list of those dynamic speakers that we had that range from community organizers to academic specialists and people in the public media. And so to culminate our program, final presentations were shared with over 20 community members and a virtual open house. Um, Here in the final presentations, this is where our participants were able to share their visions for the future. And so throughout the program, participants developed a virtual presentation incorporating the meaningful learnings from the curriculum. And in that, they created these final presentations where they were asked to use photo voice, again, a method employing pictures to highlight community strengths and challenges, and incorporating qualitative data such as interviews and community level qualitative data to explain a health challenge faced in their community and their vision for addressing that concern. And so some of those issues identified were childhood obesity, gentrification, gun violence, lack of community resources, and different effects of mental health on their communities. And so the final presentations were so good and so reflective of engaged, committed youth. And so some of the feedback we got from the final presentation was, this presentation is better than those of my research colleagues, because these kids, these young adults were into and really aware of what was ailing their neighborhoods, and had really wonderful and dynamic responses to address them. And another good quote was, very thoughtful analysis on gentrification in your neighborhood, in your community. Because again, these kids are aware and paying attention, and are ready to respond and support their neighborhoods and growing and thriving. And I'll shoot it back to Myles for program outcomes.
Great. Thank you, Adlaide, for that overview of year 2 of RAIN. What we really had to do to adjust due to COVID to make this a very successful online program. So I'm going to talk about some outcomes from that past program based on a lot of qualitative data we collected from our youth. So first, I'm going to talk about strengths, particularly around curricular elements. So the curricular element about community health, participants really enjoyed learning about not only community health and learning about assets and challenges within their own communities, but learning about what's going on across Chicago, across neighboring communities, right? And to really understand that although other communities might be having similar health outcomes as their own community, the reasons of those health outcomes can vary widely across communities, right? Particularly when you're talking about communities of varying racial ethnic backgrounds, right? A community that's predominantly Latinx versus a community that's predominantly African American will have very two different sources of reasons why a health outcome is the way it is. Another strength was empowerment, right? And again, I want to really emphasize how important this was in the program, right? We wanted to really do 3 major things, right? Build confidence in the youth, right? Make sure that not only that they learn these skills of research methods and conducting one-on-ones and building community relationships, but they were confident in using those skills to promote change in the communities, right? And another component was to make sure that they knew that their opinions matter, right? That not only that we're listening to them as public health professionals, but their community is listening to them. And that all they need to do is take their power and use it and make their voice heard and just speak to their communities, and we will listen. And lastly, another thing we wanted to do is give them opportunities and ways on how they could get involved in the community. And I think that's where both the leadership panel that Adlaide mentioned and the young health professionals panel Adlaide mentioned can really help engrave that within the participants. So they knew what was going on with their communities and how organizations are trying to solve issues within their communities, and learn about different ways they could get involved with those initiatives. Next is being challenged, right? And I think we did this 2 ways. One was introducing them to new skills and techniques. One is just even learning about quantitative data and data visualization, right? A lot of times that could be a major in itself. So for us to introduce that to them, to expose them to that and teach them that, to a lot of participants, that was a new experience. and they definitely enjoyed the challenge. They really got into it. Another part was putting them out of their comfort zone, right? I think the last session that Adlaide mentioned on session 6 on the final presentations, going into that presentation, we told them that, and they knew that they were going to be presenting to cross-sector leaders from across Chicago, from what Adlaide mentioned, right? Academic professors from universities, to hospital leaders, to people from local NGOs and community-based organizations. So going into it, many expressed their nervousness presenting, but after, they were just so thrilled they were able to do that, and they had no idea they could do that with such confidence. And like Adelaide mentioned in one of the quotes, some of these presentations were better than presentations we've both seen from professional health colleagues, right? They did such a good job with that. And lastly, guest panels. Um, our participants really enjoyed the diversity of guest panels we were able to have this year, from cross-sector organizations, right? From leaders to even someone from radio, from the media. And we often forget how important media plays a role in public health. So Parlino Rowe from KISS FM, who leads the Get Your Mind Right mental health initiative in Pilsen, was such an integral part of that panel. And it's a way for the youth to really connect with these panelists, right? Because not oftentimes do youth connect with university professors, right? Often are around university professors that often. So having a public figure like that radio host was such a big deal. And that we could have done that if this session, if Ray wasn't completely virtual, right? There's so many limitations to having panelists join um, your panel, right? Because they have to travel. They're coming from across Chicago. I know it could be difficult coming, say, from Rogers Park all the way to Mount Sinai Hospital on Chicago's west side. So for this being completely virtual, panelists were more accessible to joining our sessions. So on an operational side of strengths, one was organization, right? I think going into this, knowing that we were working with youth, we had to be on top of our game in terms of organization. We laid out expectations with youth at the very beginning. We gave them a calendar of what to expect, what was coming down down the pipeline. And we also had set reminders with the participants, right? Of, hey, we have activities coming up. We have a session on Monday. Don't forget to meet with your peer mentors. They're going to reach out to you to set reminders, because as Adelaide mentioned, this is only a 6-week program with 6 sessions, with 1 session a week. So if you get behind just a little bit within such a short amount of time, it's really difficult to catch up. And we didn't want to get in that situation because there's so much to gain from the 6-week program. Then Ray facilitators. So this was a huge kudos for Adelaide and myself, for them to say that we did a good job, that we were a strength of the program. So how we approach on identifying Ray facilitators, we had to be really strategic with this. One, we had to make sure that the facilitators were relatively young public health professionals, right? Although I'm a bit removed from the current generational lingo, I don't believe Adelaide and myself are too far removed from being able to connect with the youth. Another thing we had to keep in mind was that we had to make sure the facilitators were either from the same communities the participants were from, or that the facilitators were people of color. And that was so important because we wanted to make sure the participants were comfortable in expressing how they felt, and to know that we had an understanding, we understood what they were going through, and that we would listen, and that we were open ears to their community issues. And lastly, a program isn't as fun, energetic, is only as fun and energetic as the program leaders, right? So I think that's something me and Adelaide tried to really bring to make this program really upbeat and bright and fun. Because oftentimes when you talk about data and quantitative data, no one says quantitative data is synonymous with fun and excitement. That you don't often hear that. So it's something that we wanted to bring to this program. So I really enjoyed this quote. I'm gonna repeat it. So, you smile, and guys, you make jokes and you really talk to us and you engage us. So I think like having that energy and that enthusiasm is really helpful. And lastly, peer mentors. This was a huge strength. And this is something, as Adlaide mentioned, that participants from the pilot program really emphasized we do because one, they wanted to be involved. And two, it was another great way to bridge that gap between facilitator and participant. And one example I want to give on how this was important is that it bridges facilitators and participants to address potential issues that are stigmatic with people living in oftentimes described as under resourced communities, right? So there was one instance where a participant needed a certain technical resource that they didn't have, but didn't communicate that with the facilitators. But once the peer mentors start talking to and building that relationship with the participants, that's when we start to learn about the needs of our participants to really make this program really successful. So areas of improvement for Ray that we learned based on our conversations with participants. One, I think, broadly speaking, the online format, right? We often had issues with how strong internet connections were, the broadwidth band of like how often our participants were disconnected online from being in person. So oftentimes participants had to dial in because their internet wasn't strong enough. And another thing to consider was the learning curve for an online platform. So using Basecamp, we had to spend a little more time than we expected, really getting our participants familiar with that online platform, right? Because it was such an integral part of the program. It had our timelines, it had the activities, it had sessions that we recorded for them to come back to. And we really wanted to make that clear. So we had to spend a little bit more time than expected laying that out. So a couple more areas in terms of online is that there were fewer opportunities for relationship building among participants and mentors. Both participants and mentors both expressed that they wanted to build more of that relationship among each other. And unfortunately, being online, they weren't able to do that. Also, building a relationship between participants and facilitators, right? Personally, from my experiences from the pilot program, yes, being in person, we were able to build a stronger bond, a stronger relationship compared to this year's program. We did build a relationship, but it was definitely not as strong. And I think this quote reflects that. I would have definitely liked to meet you with you guys in person, and I feel like we could have made it feel more like a program. Another area for improvement is to add additional weekly in-class sessions. Although participants really enjoyed having that away time to do the major activities from photo voice to taking pictures in their community to having their own time to conduct one-on-ones with community members that they trusted to learn more about community-based issues. Speaking of like the, the lesser activities, they would have preferred that to be in-class sessions. A lot of participants mentioned that being online and being at home, there are a lot more distractions. It was easier to procrastinate. So being in class, they would be forced to stay on track more often. And they wanted to have more in-class discussions as well. So they thought they could get that more by having more in-class sessions. And lastly, additional opportunities to connect with advocacy or activism. And this one I completely agree with them on, right? I think there needs to be a strong component on that. But with the structure of the current program, right, being 6 weeks long, a session a week, that's just really just enough time to really lay that foundation work of learning about community health, assets and challenges, or lows and grows, how we called it, and learning about research methods and being introduced and exposure to advocacy. There really wasn't much time to really start connecting and developing programs related to advocacy or activism. Um, so I think in terms of next steps, that is definitely the direction in which we want to take the RAY program. So that is a broad summary of RAY, particularly RAY 2, and how we had to adapt to an online program due to COVID, and particular strengths and areas of improvement. But so before we get into our discussion, I wanted to open up to you all to see if you had any questions for Adlaide or myself about the RAY program.
Do you also want to do the poll questions or?
Yeah, so thanks, Priya. So if there's no questions, I want to get into a discussion with you all about your program structure, if you had to change due to COVID. But before we get into that, I want to know a few questions. I want to know a little bit more about yourselves. So I want to get into this poll. It's going to ask, what type of organization are you affiliated with? Have you or are you planning to run a youth program, or have you had to update your program to be online due to COVID? All right, we have a couple, I think a few more to put in their votes, so I'll give it about 10 more seconds. All right, great. So based on this, it looks like that some of you are planning to run or have run a youth program, and that you had to update your program to be online. So I definitely want to hear more about that, and the strategies you had to you took to make that happen. So yeah, let's get into it. So first, have you had similar experience to us? And if so, how did you address those issues? And if not, what other problems have come up in your own individual programs?
We encourage the use of the chat box.
I'm sorry, I heard a very faint voice.
I think that was mine. I was saying, and we encourage the use of the chat box.
All right. If no one has any input for that, we also have questions around strategies, on what strategies you use to move your program online. So for us, it was, luckily, majority of our activities were able to be transformed to be virtual, and we really only had to make one change, which was the community asset tour, which we changed into a panel of community health leaders. So that's what we had to do. What strategies did you, as guest of our presentation, had to use to move your personal programs online?
Hi, this is Maureen. So not youth program related, but I was helping to run an internship program for medical students. It's similar to the one that I believe Suhi has at my institution, and we this summer could not have them in the hospital. So we had to move everything online, and we found it to be very challenging. And of course we couldn't, I think maybe the hardest part was that we had to pivot to online so quickly. It was this, like, we weren't quite sure what was going to happen. They kept telling us, like, just a couple more weeks, maybe we'll be able to do this in person. And then ultimately, of course, we were not. So I think just like having to pivot so quickly was really difficult. And then also just kind of feeling guilty that maybe the students didn't get the experience that they wanted or hoped for. And I mean, there was really nothing we could do this past year to help that, but maybe, you know, spend some additional time on it for 2021 and think about how we can do that, because things like the students weren't able to access medical records because they weren't on campus. They weren't given our institution's IDs because they weren't on the campus. We weren't like able to issue them their own laptops, so we didn't want them looking at any information on their private or on their personal devices. So I don't know, I just thought that was kind of tricky. But yeah, I mean, that's great that you guys were able to do panels and things like that. I think maybe that's something that I could bring up for my own program. So thank you. Good ideas. I don't know, sorry, I'm just kind of rambling now, but yeah, I also found it to be very challenging, but it seems like you guys did a great job.
Yeah, thank you for that, Maureen. And I second your sentiment about how we had to adapt so quickly. Just to let you know, so our recruitment was supposed to take place around March, April. And as you all know, that's when COVID really started to hit. So our recruitment methods had to be essentially on a whim, be updated and try to find other recruitment methods. So I think that's something everyone had to go through, right? Because there's so much uncertainty and how to move forward. And if we could have like a blended in-person virtual program, there was so much unknown around that. So yeah, I completely second that sentiment. But as a follow-up, Maureen, did you have any benefits of being completely online?
I mean, I think it was a little easier to manage, I guess. Like typically my department would have done a lot. I mean, this is kind of selfish of me maybe, but like we would have done a lot of like in-person presentations, and there would have been, I think, a lot more hand-holding that had to happen. And this was kind of like, I don't know, maybe like a more real world experience for everyone. But yeah, that's a good question. I have to think about that. I don't know that there were any like great benefits, honestly. I felt a little bad.
Yeah, so I think the main benefit for us was being able to have the panel. So I think, as you mentioned, that's something you might want to do moving forward. I think we had the opportunity to be back in person and interacting one-on-one, I think that's something we may consider keeping, right? Having that virtual panel, because you are able to have a much more diverse group of people come in and present when they don't have to travel across the city for a single hour presentation, right?
We do have a response in the comments from Kat. I don't want to mispronounce your last name, where she says that she's coordinated a research project at her hospital for the youth, age 11 to 13, and they've been attempting to pivot more of their activities to online platforms, but there's the barrier and it's difficult. So a lot of research tasks are physiological experiments, and it's almost impossible to move them online. Yeah, understanding that is something that you guys are struggling with. Yeah, I would say for us, so we only had one thing that kind of was really physiological, which was the community assets tour, and it was probably like one of our more like substantial activities that connected the participants to their neighborhoods and the value and the importance and the things that are thriving and great in their neighborhoods. And so that was removed. I mean, yeah, virtual online takes a lot of ingenuity. I think that, so in the example that Myles gave about the one participant who needed a device, I think that one of the things that you guys may have to consider with your physiological experiments, 11 to 13, yeah, is providing them with the resources, doing a safe drop-off of the materials they'll need, and just being ready to explain stuff more extensively than you would before. I don't know. Yeah.
Can you give us some examples of those physiological experiments? I'm curious.
I'm just gonna unmute myself. So I run a lab at Evanston Hospital, and we are studying the transition to puberty in adolescent girls. So right before they get their period, and then we follow up with them over a course of a couple of years. So we do a bunch of different tests, like we do like a bladder capacity test. We have them fill out questionnaires and a bunch of various kind of more sciencey experiments. So the questionnaires we're able to do virtually, but that's only a portion of our research, and we really struggle with it. We also really struggle with engagement right now because our cohort is a little bit younger than your guys's. So we have to go through most of their parents, and their parents are so stressed that we are just not having as good of retention at the moment. It's really hard to keep them engaged.
I feel you on that. I felt like we had to tap dance and smile so hard for them. They wouldn't make eye contact with the computers. Like, you gotta look at the camera. You know, like, it's so, yeah, I feel you on that. Yeah. We had to.
Anything that I would expect anyone to solve. It's just more kind of commiserating of experiences, I guess.
For sure, yeah. But I'm a parent, and I'm trying to think of like what can be helpful for you. Because the parents aren't frustrated with you, right? It's just all of these new things that we have to adjust to, and like we're teaching ourselves, and then we got to teach the kids at the same time, and it's just like, oh my gosh, right? It could be overwhelming, but we are your ally. We are on your team. We definitely want you to support and enrich our children. So I say it's just like all about patient language. Maybe establishing that parent support is needed, and so that they mentally can prepare and themselves to support you with the activities and stuff like that.
Yeah, that's good.
So a quick question about that. So some of those activities and those experiments, were you thinking of having them conduct those on their own at home, and for the parents to report back to you on outcomes?
We are thinking about that. We're not totally sure we have the resources to do it, but we are thinking about it, yeah. And I'm not totally sure if the parents have the resources to do it on top of it, but it's definitely something that we do continuously talk about.
Yeah, definitely. And I agree with your sentiment about parents being busy, right? I think even the youth sometimes tend to get busy somehow. So trying to find time on the calendar. Yeah, so it's not like you're only working with youth, right? You're also working with youth and parents. And I'm sure there's a lot of considerations, particularly with running experiments, right? To have a controlled experiment at home, and there's so many more variables that could play a part in whatever you're trying to achieve with that particular experiment. So fortunately, Ray isn't that as clinical as that. So, but yeah, I truly understand how difficult that could be to move to be completely virtual.
Yeah, I appreciate your guys' feedback though.
No problem, and you totally have our empathy.
Thanks.
Yeah, but if you want to discuss further outside of this, please feel free to reach out to us.
Yeah, I think I'll shoot you an email if that's okay.
Yeah, that'd be fantastic. I'm interested to learn a little bit more of what you're trying to accomplish. So yeah.
Okay. Thank you.
Of course. I think we have. About 8 more minutes. Does anyone have any more questions or anything they would like to share or have like a group discussion about with their own programs?
Maybe we could think some other things that are preventing you from having to your assessment a successful virtual program. Okay, we did receive a question in the chat box from Pam. Are there things you learned from going virtual that are actually benefits that you will continue in the future? So that's for both the presenters and others in the group. I guess I'll start. So I guess, as I mentioned, the amount of avenues that we have for recruitment, that is something that we'll definitely take into the future. I think that relying on one source the first time was fine because it was secure, it was very established, but I think having multiple avenues and streams will help with improving numbers and recruitment opportunities.
Yeah, and I also just want to reiterate how having virtual panels, right? Being able to get a more diverse panel of community leaders. To get on someone's calendar, it's much easier to do that virtually than having them have to commute somewhere. So that was, I think, the biggest plus of being virtual. And then I think one more thing about being virtual, it forced us to create a digital platform in Basecamp, right? Where we were able to record sessions. I think was really helpful for participants who had other obligations they had to get to at that time, or even have resources on that platform for community resources, right? If you had to go to get COVID testings, where to go, we had pamphlets on Basecamp, and also instructions for activities at some place where participants were able to go. So I think moving forward, that too might be something we might also consider, having this ongoing platform where even though we're meeting in person, it's something our participants can come back to reference past sessions or past resources they wanted to dig up again. But yeah, to you all running programs yourselves, are there any benefits or any things you learn from your virtual programs? All right, well, that's all I had if no one had any other questions. But if anything comes up or you want to reach out to either Adlaide or myself about any additional questions to your program or how you might want to integrate some of the things we've done in our online program into your own program, such as having an online platform or being able to reach out to other community leaders and organizers, please feel free to reach out to us. Our emails are here. Asma Ali is another great team member who really worked behind the scenes to help develop the curriculum, who is another great resource. So all three of us, please reach out to us if you have any other further questions, but we appreciate your time. We appreciate you joining us today for our presentation. So thank you all.